It has come to our attention as a committee that as most hospitals are charging exorbitant fees.
Something is not right, and that is not tenable. It cannot continue.
Depictions by Deputy Chair of the Parliamentary Health Committee, Joshua Kutunyi, and Health Cabinet Secretary Mutahi Kagwe are majorly directed at private hospitals.
You hear that for 60,000 shillings in Kenyatta for one procedure is 400,000 shillings. And NHIF is expected to pay Kenyatta 60,000, and then NHIF for the same thing is expected to pay the private hospital 400,000 shillings. I mean, people.
However, the private health sector leadership continues to oppose the content of the new National Health Insurance Act, saying that costs in private hospitals are slightly higher due to the quality of services provided, and a reduction in the amount paid by the insurance will lead to a reduction in quality.
Previously, they were paying 9,500 per session. They're proposing to reduce it to 6,500 per session. So on that basis, it would mean, in effect, they have locked out all their beneficiaries who are accessing dialysis service from private institutions out of that service. That would mean that everybody will have to fall back to public institutions, which clearly don't have the capacity to provide all that service.
Monica Mudhoni, who suffers from kidney disease, highlights the challenges she goes through in public hospitals, calling for improved services as well as NHIF payments to cover both the procedure and drugs, which currently is not the case.
Personally, I do dialysis at Thika Level 4, which is a government hospital, and we find that most commodities are not consistent. They run out after stock abruptly. We also adhere to a very high renal diet that is very expensive. The machines are always breaking down, so we miss on some sessions.
The key success element in all these things is two things. One is that the public hospitals must be so well done in terms of equipment and in terms of personnel. They must be so well executed that they provide a viable alternative to the private sector.
The Health Committee in the National Assembly, while highlighting that stakeholders should be involved in decision-making that affects the health of Kenyans, has called on the National Health Insurance to conduct public participation within 21 days.
We can have a special council meeting together with NHIF. We can even afford a retreat together. Then we address this issue of pricing. Because if I'll get it from the media, I'll get it from a gazette notice, I'll get it from a patient, it will not be intensive consultations.
Ben Kerera, K24, Nairobi.